Okay, today's talk is going to be the fascinating world of poop. And this is a really important thing that we need to talk about because everybody needs to be pooping. Everybody needs to be pooping every day, and we're going to talk about why. So, poop is also called feces, or it can be called stool, or it can be called the big BM. But what it is a solid or semi liquid waste matter that is eliminated from the digestive tract. It plays a crucial role in digestive process, showing us how well our digestive system is functioning. And human poop can tell us a lot about our overall health, especially in terms of digestion and hydration. So, if we look at the drawing or the diagram on the right here, um, we can see the digestion starts in the mouth, and we chew our food, and that's really important. We take time and we're mindful and chew our food because that helps this whole digestive process. It helps break down the carbohydrates and starches. It goes down through the esophagus into the stomach, and the stomach is where we get all of our protein breakdown. And then after we go into the stomach, it enters into the small intestines, and this is this kind of pink, and then it finally enters the large intestines, and then it comes out as poop. So, what is poop made of? Well, it's made up of mostly water. 75% of it's water, except when we're constipated, and there's probably less percentage of water. Um, it's also undigested food matter, especially fiber that the body can't break down, which is important that we have fiber because fiber helps us move, softens, and it moves this feces through our digestive tract. It's also composed of bacteria and the microbes that are responsible for breakdown of many substances in the colon. So bacteria, we have so many trillions of bacteria in our small and large intestines. So some of that bacteria does come out with our poop. It also has dead cells from the lining of our digestive tract, and our digestive tract turns over. Boy, every 21 days we have all these new epithelial cells that are replacing the old ones, so that has to come out, and it comes out through our poop. Also, mucus, produced by the intestines to help waste move through the digestive tract, and other materials, small amounts of fat and proteins, and other waste products. So let's talk about the digestive process. I just covered it just a second ago, but let's just do a quick review again here. So it starts right up here in the mouth, and it's important that we do take time to chew our food and sit down and be mindful. And this starts the whole carbohydrate breakdown, and then enters the esophagus and down to the stomach, where again we have the pepsin in our stomach breaks down proteins. And we also have a lot of acid in there called hydrochloric acid. And that's really important that we have that acid in there because that kills the bacteria and the viruses that enter through our foods. And sometimes it's on our fingers and our hands when we eat our foods, and that enters the digestive tract. And then after that, it enters the small intestines. And the small intestines are responsible for most of the absorption of the food, our nutrients, and then it enters the large intestines. So water and salt are absorbed in the large intestines and remain solid waste, and it remains a solid waste and stored in the rectum before being expelled. So this is where it's important to be hydrated because we want that feces to have some softness to it, and we don't want it to be hard. And when it becomes hard, it's just a dehydration. So we want to make sure we're well hydrated. And we want to make sure we have a little bit of fiber because that helps keep it soft and it helps move it through the digestive tract too. So what should our bowel movement or our poop look like? Well, if we look at the chart on the left here, we can start with the normal is going to be your type 3, which is normal, and our type 4. So this is what it just looks like. So a sausage shape with some cracks in it on the surface. That's a typical type 3. And then our type 4 is like a smooth, soft sausage or snake. This is kind of what we want to shoot for right here. But these 3 and 4 is considered normal. If we have these little pellets that come out, this is a type 1, and this is where we're pretty darn constipated. And then if it comes out type 2 with these soft pellets that are just kind of stuck together, that's a mild constipation. And then when we start to, when we're type 5 is soft blobs that are clear and have no edges to them. And then that knows we know we're lacking some fiber there. And type 6, mushy consistency with ragged edges, then this is considered mild diarrhea. And then liquid consistency with no solid pieces is a severe diarrhea. So the role of water in poop. So water is essential for the proper poop formation. Most of the water absorbed in the digestion occurs in the small and the large intestines. If too much water is absorbed, the stool becomes hard and it's difficult to pass, and that's what we call constipation. And if it's not enough water is absorbed, the stool becomes too loose and watery, and then we have diarrhea. So hydration plays a key role in keeping stools soft and easy to pass. So this diagram over here to the right just shows the different milliliters that are absorbed in different parts of the small intestine, or in the intestines. So this would be the small intestines, and this would be more towards the large intestines, and it just shows the milliliters of absorption. So in the small and large intestines, we have something called gut flora, and it's really important, and the gut flora affects our poop formation and absorption of nutrients, all that. So the human digestive system is home to trillions of bacteria that collectively known as the microbiome. That's your second brain in your gut. These bacteria help break down food that the stomach and small intestines cannot process, such as fiber. The gut flora also plays a role in producing certain vitamins and protecting the gut from harmful bacteria. So disruption in the microbiome through antibiotics or poor diet can lead to digestive problems and affect our poop. So just a couple key things in diet. Fiber, and fiber is found in the produce section. When you go into the produce section, that's all fiber. It's found in fruits, vegetables, whole grains, and fiber adds bulk to the stool and helps move it through the intestines. So fiber is very important in our diet, and the more fiber you eat, it's kind of the healthier foods you're eating too. So that's important to know. And fatty foods, such as our fried foods and all that, may result in softer and greasier stools, giving you more diarrhea. Processed foods low in fiber, which can contribute to constipation. And water intake is super important for the formation of well-formed stools. Hydration is super important to many things, especially for poop. So of course you've noticed over the course of your life that poop has different color. So what does that mean, and how can we interpret this? Well, if you have brown poop, that's kind of normal. It's due to the breakdown of bile in the digestive tract, so that's kind of normal. And then if you have green poop, it's due to eating a lot of leafy vegetables or green food coloring, or foods that have green coloring. And then if you have yellow, it indicates excessive fat, probably from malabsorption disorders like celiac disease. Black could indicate bleeding in the upper digestive tract, or taking iron supplements, and red could be a sign of lower gastrointestinal bleeding. So healthy poop should be well-formed, brown in color, and easy to pass. And we covered the type 3 and type 4 on the Bristol scale, so you kind of know what it should look like. It should be soft but firm with smooth surface. Poop should be regular, ideally once a day or up to 3 times a day. Really, 1 to 3 times a day is the best. And a good sign of healthy poop is when it's not painful for you. It just kind of feels kind of natural. So poop can also help us to identify problems that are going on in our body. So for instance, blood in the stool could indicate hemorrhoids, anal fissures, gastrointestinal bleeding, and that's when the stool is going to be kind of dark and black. Mucus in the stool, excessive mucus may suggest inflammation and bowel disease like IBD. Changes in consistency, chronic diarrhea, or constipation can be signs of digestive issues like IBS. And changes in frequency, sudden changes in how often you poop may indicate underlying health issues like food sensitivities, or inflammation conditions that are happening in the body. So I don't recommend you do what's in this picture here. Don't pick up your poop and smell it. It's probably not necessary to get that close to your nose, but poop smells because of the bacteria in the intestines breaking down food, particularly proteins, and releasing sulfur gases. So certain foods like asparagus, coffee, vegetables can make poop smell stronger. And I think we've all had that when we've had asparagus. That kind of definitely affects our smell of our pee. Health issues, unusually foul smelling poop can indicate indications like malabsorption, infection, or digestive disorders. So everybody has their own individual smell, and it should be pretty consistent. And if it starts to change and maybe become very foul, then you know, again, it's an indication there's a problem going on in the GI tract and we need to investigate. So how often should you poop? Let's just make it simple. Every day. And like 1 to 3 times a day is probably the best. And consistency, it's good. Your body, when it gets into a rhythm, and especially when your circadian rhythm is working like it should, you should be pretty consistent with your times too. So you should be consistent and you should go every day. And you know, some factors that can affect it are the diet, food sensitivities, hydration, your activity level, and just your metabolism. So those are things that can affect it. And again, pooping in health. So, you know, we can use poop as an indicator of our health or indication that our body is not doing well. Maybe some digestive processes that are not going well, or even disease processes. So we can use poop as a diagnostic tool, what's going on with our body. Maybe you never thought of that before, but it's true. Okay, let's talk about the position we need to poop in. So this young lady right here is sitting on the toilet with a squatty potty. This is actually one of the best positions to line up your bowels, so it's for the easiest defecation. So this position is best. So if you're sitting on a standard toilet and you just lean your body forward, it kind of puts you in the same position. You want to try to relax your pelvic floor, and one thing you could do is just take a deep diaphragmatic breath and breathe in through your belly, and then just let your bottom part of your pelvic floor, right by where your pooper is, just let it kind of relax and spread out, and then try to move your bowels like that with it soft and relaxed. So squatty potty, breathing patterns, diaphragmatic breathing, and trying to relax your pelvic floor are some of the best things you can do to help to have a bowel movement. So I think we might have all been in these situations before, just like this gentleman's having some real problems on the toilet where it's kind of difficult for him to use the potty. So constipation is a real problem, and it's an issue. And if you become constipated, what happens is then your poop sits in your large intestines, and what the body will do, all of the toxins that your body has tried to remove, if the toxins just sit there, your body will reabsorb them back into your body. So constipation leads to reabsorption of toxins that your body's trying to get rid of, which can be really, toxic and harmful to your body. So some of the symptoms of constipation would be low fiber intake, dehydration, sedentary lifestyle, certain medications, or certain medical conditions. So, and there are ways when you're constipated to help move your bowel. So increasing fiber, make sure you're hydrated, and make sure you exercise. And magnesium citrate is probably one of the best things to start with to try to move your bowels. So diarrhea is definitely an issue, and the definition is frequent, loose, watery stools, often with urgency. The cause of this can be infection, food intolerances, food sensitivities, medication side effects, you know, different type of gastrointestinal diseases. So the important thing here is you want to maintain hydration because you're losing a lot of water, a lot of fluid, and you can become dehydrated really easily. So you want to make sure you maintain hydration. And here are some 10 really important facts about poop I thought everybody would want to know. The average person poops around 1,000 times per year. The longest recorded poop was over 26 feet long. I have no idea how they measured it. I have no idea how somebody did that. Your poop has a unique smell. Yep. A healthy poop should float. There are over 1,000 types of bacteria in your poop. Elephants can produce up to 220 pounds of poop in a day. Whew. Poop is a key ingredient in some fertilizers. There's a maximum of a human poop has been used for currency. Dolphins use poop as a communication tool. And your poop can float in the ocean for years. So just to summarize about our poop, it is really an indicator of our health. So if we pay attention, it gives us an indication of how our GI tract is doing and how our body just the overall health of our body is doing. So I encourage you to pay attention to changes in your poop. They could be the early signs of health issues. Remember to maintain healthy diets, stay hydrated, seek medical advice if unusual symptoms arise.